Welcome everybody, thank you for coming. If you don't know me, my name's Paul Jennings. I have the privilege and pleasure of being the chair of Hospice UK. It's my role to welcome you this morning, to thank you all for coming. I did just wonder actually, if you wouldn't mind, earlier on I tweeted a picture of this auditorium completely empty. So would you mind just all smiling? A bit wider. Thank you. If you don't mind, I'll tweet you later. So welcome and thank you for coming to Glasgow. It's great to be here. It's quite a long time, I confess, since I was last in this wonderful city, and I've been reminded already by our plenary speaker what a fantastic place Glasgow is and how I've wasted my entire career by not working here and working in England, so I apologise for that. Can I thank our sponsors, if I may, first of all, our gold sponsors, Towergate, who we'll be hearing from shortly with their award, Dreamscape Solutions, JDDK Architects, and Legacy of Lives. I'd like to also thank our other sponsors and our exhibitors, and can I invite you to spend some time in the exhibition hall and meet the various exhibitors and talk to them. They work hard to be here and they have interesting things to say, and some of them even have prizes, which is always a good thing to have, isn't it? I'd like to say that I've been briefed what to say, but I tend to go off brief quite often. One thing I've not been briefed to say, and I really want to say, is thank you to the Hospice UK team for setting up this conference. The amount of work that goes into this is just incredible, to get everything in place, everyone in place, virtual, hybrid, the whole thing, the branding and so on. And actually I'm told that some of our colleagues were here yesterday morning at 6 o'clock, would you believe, making sure that the carpet was laid correctly. They've really worked incredibly hard. And none of us have been helped by Avanti West Coast in our mission, have we, over this week. The presentations from the conference will all be available online in 10 days. You've been given, I think, a password with your email so you can access them, and those will all be loaded up. I have to ask you to turn your phones to silent. This is where I nervously check mine for the 14th time, and yes, it is silent, because my phone plays the red right hand quite loudly, which you will know is the theme tune of Peaky Blinders, because I'm from Birmingham, and it's very embarrassing when it goes off, so I request you to turn yours off as well. If you're watching online, you can put questions just as easily as in the hall. We're asking people to use Slido, which we used last year, and at some point there'll be some details that tell you how to log into Slido if you haven't already. I find it really helpful actually, because Slido is essentially, it's anonymous, and some of the questions that I get are so rude. And I just know that people wouldn't have the courage to ask them if they had to stand by microphone number 3. So please use Slido, and if you're online, use the Q&A box underneath, and you will, your questions will appear with the same priority as in the hall. I've been asked if I could just mention to you the ethical conundrums roundtable sessions. We've set these up for the first time this year. You'll see them in the programme. They are deliberately meant to be a safe space for us to have open and honest conversations, discussions about some of those things that maybe we find quite difficult to discuss in other settings. So we'd be interested to have people come to those, if you would, and really interested to hear your feedback from them as to whether it's something we should continue to do with next year's conference. But we just think there are some burning issues in our world that we need to have conversations about, but people can find quite difficult, they're quite challenging. People sometimes feel they need to take particular stances or positions. So these are safe spaces for us to have open and honest conversations about some of those interesting and difficult ethical dilemmas. I wanted to say also thank you to Craig Duncan, actually, and the SLT, Senior Leadership Team, because they held the fort for 9 months while we went through an interim process to find a chief executive. I'm going to introduce to you shortly, although you already know who he is. We felt it was really important that we had an inclusive process to appoint the Chief Executive. We wanted to take time to consult the membership through the Advisory Council. The Chief Executive is your Chief Executive as well as our Chief Executive. So the process took quite a while, and I'm really, really proud of the team and the way they kept things stable and running, still on the back end of COVID, if you remember, while we went through that process. I was reflecting on the way up here that it's almost, I think, exactly 3 years since we first heard in the world of public health that something was going on in China. And since then, we have had unprecedented use of the word unprecedented. Everything has been unprecedented since then. We had a worldwide pandemic. We had a vaccine that was developed in what seemed like a lightning flash. We went from having soap and oxygen as our only weapons against COVID to a whole range of treatments, to a place where we are learning now to live with it. And it's on the back of that, war in Europe, cost of living crisis, a whole series of things that we have to cope with. And Toby will talk about some of that. But in the midst of life, as I say, we're also in the midst of death. And the work that you are doing, the work that you're doing individually with people who are moving to the end of life, the work that you're doing, that we're doing as a movement to try to get end of life taken as seriously as the start of life is incredibly important. And I thank everybody in this room for their work and their part and their participation in that. So without further ado, I did actually threaten him with doing a ring walk and coming down the aisle, but he decided he wouldn't do that. And we're not allowed to play Eye of the Tiger either, apparently, because we're being live streamed. But without further ado, can I introduce our new Chief Executive, Toby Porter.
Thank you very much, and welcome. On behalf of everybody at the whole team at Hospice UK, may I give you the warmest of welcomes to this year's National Conference, Finding a Way Forward. Thanks so much for taking time from your busy schedules to be with us. These next 3 days, it's wonderful for us, and of course I hope for all of you to have such a large gathering of the country's hospice community. And I'd like to extend my gratitude and welcome to our sponsors, our exhibitors, and our conference paper authors and poster bearers as well, whose work you'll see in the halls. I'd also like to say a personal thank you to Kirkwood Hospice in Huddersfield, if they're here, because I bought my Jaeger suit for £12 from their online shop. And support your local hospice, you know what bargains are to be had. Because I realised I hadn't got any suits after the last few years. So we're delighted to be here in Glasgow, first time actually, and to have guests and speakers from those, not just our Scottish hospice colleagues, but those designing and delivering the new Scottish Government strategy on palliative and end-of-life care. For those of you getting to grips with the ICS systems and rollouts and meetings and boards in England, you have a chance to learn from 6 years of experience here in Scotland, where integration of health and social care authorities and services has been in place. Scotland is also the focus and really the front line for, in the UK, for one of the most controversial issues facing our sector and society at large, with the proposed assisted dying for terminally ill adults bill lodged at the Scottish Parliament in September and expected to be voted upon in 2023. You can listen or contribute to discussions related to this topic at our ethical conundrum meeting tomorrow morning. So we welcome delegates from all 4 nations. There's so much to learn and to share between colleagues from the different countries. And it's a proud and happy moment for me personally, as Paul mentioned, because I welcome you to this conference for the first time as the CEO of Hospice UK. I started my role in the end of the second week in September, which to date is only 2 weeks after Liz Truss started her new role. So I kind of feel the fact that I'm here at all is a success indicator of my first 2.5 months. It's been great to get to know the Hospice UK team and already meeting a good few of you and your teams. You make me all feel very welcome. Thank you. The work we do as a hospice sector couldn't be closer to my heart. As many of you know, it was my privilege to work for 6 years as Chief Executive with Acorns Children's Hospice, during which we faced and overcame a succession, really, of very serious challenges: financial, service cuts, job cuts, coming within a whisker of closing one of our 3 children's hospices, actually the one in the most deprived geography. Then the COVID pandemic, then higher than normal clinical vacancy rates. So I come into this role with the eyes of a hospice CEO, and certainly under no illusions and of the daily challenges you and your teams face. Yet for all of the challenges, I still think that working in a hospice often feels like the best job in the world, due to the people you meet, your clients, their families, your workforce, your volunteers, those whose compassion and generosity in the community literally keep the lights on. You all do incredible work, and our hope is that we at Hospice UK can give you something back in the next few days. And so you return to your workplaces energized with some new friends and networks in the community and inspired from being here. So 10 years ago, last month, some of you will remember the Commission for Hospice, the Commission into the Future of Hospice Care published their final report. And in her foreword, Dame Claire Tickell, who chaired the Commission, issued our sector a challenge. Hospices will need to keep an unrelenting focus on the needs of all those who live with life-shortening illness, on their families, on their carers, and be brave in their response to these needs. Well, this is the first conference where we would hopefully all agree that the worst of the COVID-19 pandemic for society is long behind us. So please allow me to congratulate, but also to thank you and your teams for your bravery and for that unrelenting focus on your patients during those awful times. Despite serious risks to themselves and their loved ones, your teams found ways to support your patients and your communities and keep your doors open every day of the pandemic. As a sector, hospices supported the NHS and the nation. Mostly the hospice sector was the only sector in the UK health and social care system that allowed family members to be with their loved ones at the moment of death, which I think is something of incredible importance and positive divergence to the practice as a whole. Continued donations to local hospice charities to support the most vulnerable were a powerful expression of the compassion and unity at the heart of most local communities and an antidote to the fear, polarization and division that stalk us. And while none of us would ever want to experience this again, we've arguably came out a stronger and more respected sector with a publicly acknowledged mandate to educate and lead the wider health and social care sector in palliative care. You're the experts. Your approach epitomizes what every person in the UK should have at the end of their life: true choice, support for them, their families and their loved ones, excellent clinical and nursing care, alongside compassionate bereavement support. We all believe in the fundamental right to a good death, but it's still the case that 1 in 4 people in the UK are unable to access adequate end-of-life care. The recent passage of the amendment to the Health and Social Care Act promises a country where good end-of-life is available and a right for all. And our community played a key role in coming together to advocate for and secure this legislation. But now we need to hold the duty bearers to account for turning this right into a reality. Our vision at Hospice UK is for that hospice care for every person in need. So there's much more we all must do. We must find a way forward. We must ensure that hospice care can reach everyone in our country, no matter where it's delivered and by whom. We must all unite behind the goal of changing end-of-life care for everyone for the better. People need and deserve better in this country. So expanding hospice care is no easy task in the best of times, and these are far from that. Instead of the calm and restorative post-pandemic recovery period that we all dreamed about for 2 years would be there for our teams and our organisations, and which they so deserved. Instead, hospices and others involved in the planning and delivery of end-of-life care face a new set of present and really very serious challenges. Firstly, our guiding star and whole ethos of hospice care is a total focus on the patient. But what does that mean at a time when the current state of our wider UK health and social care system is such a huge concern? To quote again from the 2013 Commission report, as the environment of care threatens to fail too many and too often, hospices will need to unite in their thinking and develop a strong voice individually and collectively. That's obviously more relevant than ever today. I know everyone here will be alarmed as professionals, but also as citizens, by the evidence of demand so obviously exceeding capacity wherever you care to look across our health and social care system, in our community services, our hospitals, our care homes, and even in our ambulances. What do phrases we value and use, such as patient-centred care or the need for an all-system approach, mean at times like this? What should and what can we try and do as an independent hospice sector to try and help? And of course, we're not immune from some of these challenges ourselves. The cost of living crisis affecting everybody in and associated with the hospice sector, the children and adults that use our service, their loved ones, our staff and volunteers, rising costs and falling donations, also bringing obvious jeopardy to our charity business models. At Hospice UK, we've listened to our member hospices when you said you wanted us to speak early and forcefully about the potential impact for hospices of these cost of living and energy increases. Working with some of you, we've got some compelling and hard-hitting stories out into the mainstream national media over the last few months, including major items on Channel 5, BBC Breakfast, and national newspapers. Hopefully that would have produced a conducive backdrop for you then to do your local media and have your discussions with your local commissioners and supporters. We're also working directly with senior civil servants and politicians on how hospices might be supported directly with energy costs after the end of the period covered by the current business price cap. We'll continue to do what we can do for you in this space, making sure that people understand what good end-of-life should be, what might be at risk, and why proper and predictable statutory funding remains so important to the long-term stability of our sector and of our services. Workforce probably is and probably will remain the most challenging issue of all for the hospice sector over my time as Chief Executive. You can join sessions focusing on this specifically at the conference. And we believe that every hospice team has something to contribute through experiences and ideas about how we continue to attract and retain the people we need to deliver and plan our services now and into the future. We know our people are concerned with pay as they struggle themselves with the cost of living crisis. But pay and conditions are just one of the priorities those working and volunteering with hospices are raising. Others include a focus on values and behaviours, promoting positive, healthy organisational culture, putting in place inspirational and responsive leadership, as well as stronger development of clinical career pathways, education networks, a focus on supply, recruitment, retention. Our collective call for action, each and every one of us, is to be enthusiastic and passionate public advocates for what a career in palliative care can be in our local communities and nationally, while doing what we can to make our own organisations the best possible place to work. At this conference, you'll get the opportunity to share experiences of working with the new integrated care boards with your fellow professionals and to answer key questions. What impact does your input, does your engagement have? Do you truly feel that you are able to contribute expertise and technical knowledge to making the whole system work better? As individual hospices, Is the process helping you to forge or see the potential for new partnerships and collaborative working? Are you seeing opportunities for new funding coming out of the discussions? Most importantly, does the process make you feel optimistic that this will genuinely result in better end-of-life care and palliative services in your region in the future? I hope this conference will encourage you to think about how we can work together. Hospices across the UK are now an integral part of their health and social care system, probably better known and better respected than any point previously because of the role you all played in the pandemic. The door is open for you and your teams to bring your expertise and influence to bear to provide good end-of-life care for members of your local community who until now you've not been able to reach directly. And if I can make a final quote from the Commission into the Future of Hospice Care's report from 10 years ago. It is through our place in this wider system that we will find ways to deliver services to populations rather than reaching only those individuals who find their way to us. Our commitment to the idea that everybody get the care they deserve when illness can no longer be cured has a significant implication. Every hospice that welcomes this aspiration must also accept the consequent obligation to consider how best to use their resources as part of the system of care that will need to be deployed. To obtain change on the scale required means working in partnerships with each other and with providers of health and social care. So we gather here in Glasgow, the worst of the pandemic behind us, maybe the worst of the cost of living and health and social care crisis ahead of us. Of course it feels challenging, but we will find that way forward. Hospice care is a sector, but it's also a calling. Cicely Saunders said that we can relieve suffering if we put our minds to it. So our duty now as a hospice sector is to put our minds towards finding a way forward for hospice and end-of-life care in the world, not as we would like it to be, but as we find it here now in 2022. Thank you and enjoy the conference.